Hi, this is Smita Kumar, and you're watching Medicircle. In our Top CEO series, today we are talking to Shipra Dawar. Shipra Dawar is the founder and CEO of IWill&ePsyClinic, leading mental health player in India. IWill is the first structured therapy app in the world. Hi, Shipra. Welcome to Medicircle.
Hi, Smita. It is such a pleasure to be speaking with you, and let me congratulate you for the phenomenal work you are doing in the field of media combined with health. I think this is the need of the hour, and specifically with the pandemic roaring our lives left, right, and center. I'm glad someone took this up, and so glad to be speaking to you today.
Thank you so much. So to begin with, Chipra, as we all know that the three major challenges of the healthcare industry today are affordability, availability, and accessibility. So what, according to you, is the solution to eradicate these issues?
You're so right. Actually, the triple A, challenge of the healthcare is the key challenge. How to make healthcare services affordable, accessible, and available when a person needs it. I think the one of the answers really to this is digital health. And the reason why digital health is a big answer to this is because it makes we have doctors or therapists or psychologists or psychiatrists, whatever specialty we are looking at. The doctors are largely concentrated in the top tier 1 or tier 2 cities, while the need for healthcare and the need for quality consultation exists pan India. We are a country of 1.3 billion people. So really, to make quality healthcare available as it is to a Delhi citizen, to somebody sitting in a very remote area in Bihar or a very remote area in Assam, you need to have a solid digital solution that enables it. So that's the number one reason in terms of accessibility and now availability. In case I need a doctor at the wee hours of in the night, I had a panic attack, I need to speak to my therapist at 12 in the night. What do? I can't run to a clinic. I can't run to a hospital. But if I have a digital health solution, I can access it in time. And then the thought about affordability. If we are able to run at least consultation, at least a big part of our healthcare value chain online virtually, we are cutting the costs down in terms of good, like only operations. We're not cutting the cost down on the quality of the clinical care, on the quality of the doctor, but the associated extra costs that come with this. And this benefit we can pass on to the end customer. It's not something which no company should ever profiteer at the cost of someone's well-being. So the good thing is you save that cost, and you pass that cost benefit to the end customer. So I think for a country like ours, digital health along with the physical health structure and the integration of it and the sync of it is so important. Digital health will never ever replace the physical healthcare, but these two need to coexist, have to coexist, and this pandemic has only accelerated the step towards that direction. So really, digital health is one. The other, for affordability, accessibility, and availability, is really we need to have a bigger insurance play in this country as well. A lot of the developed countries that we know of, a lot of their healthcare, whether they are people with pre-existing conditions, a lot of it is covered through insurance and through payers who can pay. Some, while I see that we have adopted insurance to, but we've just tiptoed on it as a country. We still need better insurance models really that suit the country demographic, the kind of country that we are. We can't just bring in any model from the west and try and put it here. But universal coverage is one area that we need to work on, and where our focus needs to get in. And I am seeing the under the leadership of our current prime minister and the government has already started talking about a national digital health mission, and lot of things around that. So a lot of work needs to be done on that side, but digital health and universal healthcare cover are really the two levers which will help us solve, to a larger degree, this problem of AAA that exists in India.
So I think digital is the key.
Yeah.
So Shipra, how has your journey in the healthcare industry been?
I would say that it's been humbling, as one word. I think you can be anything in the world, but when it comes to really bringing back smiles on someone's, face, when it's about helping someone, specifically we working in mental health. So a lot of the people who are seeking help from the platform are those who have given up sometimes on themselves. They could be the top CEOs, they could be anyone, but it's just that they don't feel good within them about them. So to return that liveliness to them, and to some the livelihood, and for some saving the life, I think that is the biggest humbling experience that anyone can have.
Yeah.
Of course, healthcare is one industry. There a lot of innovation is needed, a lot of patience is needed. You need to work with very different stakeholders. You're working with doctors, therapists, you're working with, your tech teams, you are working with the patients, and you're managing this, universe of very different sets of, very different set of workings, and very different set of expectations. To bring all of that on one platform definitely becomes a challenge at times, but then the one only moves forward. So it's also a lot of one has to really brace oneself to be in the healthcare entrepreneurship sector or entrepreneurship, because it isn't as easy. And the other thing is that you have to keep your ethics at the top of everything, because while in other industries you can get away with certain things, with healthcare the one principle that one needs to follow is never ever profiteer at the cost of someone's well-being. So when you're doing that, your growth and your progress initially can be slow, so you need a lot of patience, to cross that chasm, to cross those barriers that come. But eventually it's rewarding, it's humbling, and it is exhilarating, and it's exciting, because you are sitting at the brink of innovation, and you're sitting at that cusp of innovation and life.
Surely, surely. We have seen a lot of changes in the way healthcare has been. Like due to COVID, there has been phenomenal changes in the way we see healthcare and we avail the healthcare services. So, what, according to you, is the future of healthcare?
Yeah. The future of healthcare, first of all, is that it will be a primary, a primary focus of an individual. That's number one. So health was always set to be most important, but it was never believed to be most important.
Yes.
Like we always kept our work first and kept our other things first, and health used to always take a backseat. So the one change that the pandemic has done, and done for good, is that it has brought the health before the wealth
Yes.
that it needed to be in the minds of people. The consumer and the healthcare customer, or the patient, or the family has understood that nothing before health, literally. So that's first thing. So in future we are definitely going to see, even when we are past the pandemic, to people really taking care of their health. The second, of course, is digital health. There's no way that we are going back to not having digital health as a very integral part of the healthcare value chain. On the contrary, we would see more and more movement of traditionally non-digital, healthcare value chain or supply chain segments getting into the digital health side. So that is second. The third, of course, is ethical use of AI to help a clinician make better diagnosis, make a better treatment plan, which is totally assistive. So AI will not be replacing a clinician, will not be replacing a doctor, should never do that, but it will play an assistive role in this, and that is also one of the future trends that we cannot run away from. I mean, it's going to be there. So those are really the top three that I see happening. And number fourth, really, I do feel a lot of participation now from the public sector would also increase, because from our own experience in the pandemic, we saw that public private partnership, even for IWill and ePsyClinic, we worked with 7 governments on a public private, a partnership model, where of course, so this will become the model of the future as well. You will see public health sector really, really improving, and and becoming better and better, of course, with a lot of work done with the private companies as well.
Sure. India's total healthcare spending is at 3.6% of GDP, which is very less when you compare it to the developed countries. Like US
Yeah.
spends around 18%, Japan 10%, even Bangladesh spends more than us. So do you think it's high time India needs a generous amount of spending in the healthcare sector?
Of course, I mean, it cannot go without enough stress on this point that we need more spending of the GDP on the healthcare. One of the I mean, I can never say why it kept at the back seat as it was, but one of the reasons why it should be, ahead of everything on the GDP budget is because when you take care of the health, when the primary needs of health are met for the citizens, you absolutely increase productivity, you absolutely increase the burden of cost that otherwise then falls on families and then ultimately on the nation. And also you ensure, a much healthier and a more productive and a more, better society. So absolutely we need to do that as a focus. And also the healthcare should contribute more to the GDP as well. There are a lot of healthcare models that are rising, that need to rise. If you look at the investments in healthcare, so while you would see venture capital and PE funds investing a lot of money in other companies which are in e-commerce or are in fintech, if you compare that to health tech, it isn't as much. So that needs to also increase, because we need to generate more employment, we need to generate good models of healthcare. And then of course, as a larger ecosystem, as a country, we need to spend more, because right now even the basic needs of an individual on a pan India level are unfortunately not met. I do see that in the last 3 to 4 months, a lot of focus, a lot of planning, and a lot of implementation has already started in, really ramping up the work on healthcare by the governments. I just hope, and I'm sure that this trend should continue, and 2020 onwards, or 2021 onwards, this should be the era of supreme healthcare. Like we had an era of IT, we had other era. We really need to put health care, wellness on the top of every list that we have. And I just hope that people who make policies and the people who implement them are listening, because that's the need of the hour.
Definitely. So that was really, really cool. I mean, thanks so much, Shipra, for joining us on this quick chat on Top CEO series. I feel really proud talking to women entrepreneurs, especially because it's high time women take the front, and Indian investment companies should be looking on for women entrepreneurs, women who are actually leading such organizations, especially in healthcare. You are not only doing good for the society, but you are also inspiring a lot of other females, a lot of other people who have never thought of giving entrepreneurship a chance or an experience how it would be. I know it is really a roller coaster ride, but people, I mean, women entrepreneur like you would surely inspire and give them a new reason to work for themselves, to stand for themselves. So thank you so much, Shipra, for joining us. And one quick thing, because I think IWill is really a good name for the institution what you're running. I think people don't take mental health that seriously. Like we are still, there's a taboo. If anybody is having some distress or something, or if he's depressed, if he's gone in depression, the parents also hide these things. They don't feel like going to doctor. They don't want to take any healthcare assistance, but that is really, really dangerous. We have seen in like Sushanth, I don't know what has happened, but even after COVID, during that COVID, there were so many cases of mental depression, because people who never like used to, I mean, close down in a room and they cannot go out, they cannot meet friends. like my 5-year-old kid used to ask mommy why I can't go to the garden. So it was, see, it's a stress which we may not understand, but we need to tackle it very, very intelligently. I think you guys are doing a great job, and I think in the time of COVID, it is really, really needed that you take care of these people who are actually facing these kind of conditions and take them out and let them speak. At least we need to talk. So I think
Yeah.
here we are actually facing a problem. We don't talk. If
Yeah,
anybody is having, yes, please.
you're so right. And there is such a misconception around emotional and mental health disorders in India and issues in India. We unfortunately start imagining, somebody who's completely lost touch with the reality as an emotional mental health situation. While emotional and mental health issues, I mean, WHO study says that about 20%, and this was pre-COVID,
Okay.
20% of all Indians suffer from emotional and mental health issues that need clinical intervention. And these are people who are the best of students in class. I mean, this is unfortunate. How many IIT students have committed suicide? What could be wrong with an IIT student? It's just the fact that the mental and emotional health topic has been brushed under the carpet. We don't want to talk about it. And then when one of our most talented child, somebody who was going to lead our future, we lose them to emotional and mental health, and then we start talking about it, and that too in very small circles. Unfortunately, now things have changed, but a lot more needs to be done. I had seen that there were stories of an IIT student dying because of a suicide, and people had written coward under that. And with that kind of insensitivity, that kind of just being so out of touch of reality, like rather than thinking somebody who has emotional and mental health issue is out of touch or it doesn't have an insight into reality, we sometimes have that problem, and yeah, so you're so right. In the West, it's really normal. I have studied and lived in Australia as a 19-year-old child. I was there, and I can vouch for it that an OPD of a therapist was always more full than an OPD of a general physician. So it's that normal. I think we really need to dust this stigma.
Definitely. I think we need to talk first. And I think we should be having campaigns and webinars. Like if you're having anything, like, see, we are human beings, and physical disorders are similar, like mental disorders are similar to physical disorders. You need to go to a therapist, you need to talk to people, you need to get out of it. But if you're not at all, I mean, considering it that's a problem, you will never find out the solution. So I think IWill is really doing a great job, and thank you. I mean, all the best for your future endeavors, with especially with IWill, and I hope you keep on inspiring people and taking out people from their mental dilemmas.
Yes, thank you so much. Thanks. And it's been a pleasure. And I am so glad to have a first integrated, media health intersection in the form of Medicircle. I wish that this becomes one of the most subscribed, to news portal or whichever way you want to categorize it, because I think the more informed a consumer is about the various aspects of health, the better it is. And really, there is a big gap that existed that Medicircle is filling in. And I just wish you are also a woman entrepreneur. And I wish nothing but immense success to you, in your journey of uncovering the challenges and the truth of the healthcare industry.
Thank you so much for your kind words. I think we are trying to make Medicircle the voice of healthcare. I want people to talk. I want people to come on this platform. I want people to know what is exactly happening. And I think through our small initiatives, we are trying to change lives. I hope so. And it's a long way to go, but really, I think we are on the right path.
Absolutely, 100% you are.
Thanks, Shipra, for your kind words. And thank you for joining us at Medicircle today.
Thank you.